Madam Mrs. هبة ممتاز, General Manager Planning and Market Research, Karnak Travel, EgyptAir Airlines. مدام هبة ممتاز, مدير عام التخطيط وأبحاث السوق قطاع السياحة, شركة مصر طيران الخطوط الجوية.
مساء الخير جميعا. Good afternoon. First, I would like to thank Dr. Ayman Salah, Chairman of the Board of Directors, EgyptAir Hospital, for inviting us, Karnak Travel, as the tourism arm of EgyptAir Airlines. And then I will give you a brief about our sector, which is the tourism sector of EgyptAir Airlines. And then I will speak briefly as well, because I think everything was said before I come to the stage, almost. But we have a strong project, EgyptAir Airlines, in cooperation with EgyptAir Hospital, that we already achieved the great steps in. I will talk about the history of the Karnak sector, which is the tourism arm of EgyptAir Airlines. Karnak Travel was founded at 1955, working in the field of tourism since for over 60 years now. We have offices inside Egypt, 7 offices in Cairo and in the almost famous cities in Egypt, which is Luqur, Aswan, Hurghada, Sharm el-Sheikh. This is also besides the EgyptAir offices all over the world, over 70 offices. Karnak Travel is specialized in several activities related to tourism, which is the inbound tourism, the outbound. We are the sole travel agency who has a transit desk inside before the airport control to provide the transit tours, quick tours to travelers or to tourists coming and going beyond Egypt. We also have the Hajj and Umrah, which is the Muslim pilgrim. And we have also the conference and special events department that handles and organize events, conferences, and all related services to the conference. We have also the vacation center. It's a newly touristic center in Cairo to handle all the inbound and outbound and Hajj and Umrah services. Of course, Egypt is known as one of the oldest civilizations. We have history, we have nature, we have the ability to provide stunning beaches, to provide wellness centers and wellness places for different kind of medical treatments or medical therapy. We also arrange tours and packages for over 100 destinations and over 10,000 hotels all over the world. This is a brief film about the destination. We also arrange conference, exhibitions, gala carnivals, gala events, all kind of night events that can be organized. And then I will speak about the medical tourism project in cooperation with EgyptAir Airlines, as I said, and EgyptAir Tourism, Hospital. We worked in this especially with the market of African market. في الأول يعني at the beginning I will talk about facts about medical tourism in Egypt. Egypt is now one of 46 global destinations ranked within 2020 and 2021 in medical tourism index. Of course, Egypt has a historical connection to medicine, first doctors, first medicine, and one of the oldest papyrus preserved till today is the Eders papyrus that has medical treatment from ancient Egyptians. Also, Egypt offers a significantly lower cost, as Dr. Samih and the previous colleagues who has presented here, because of many conditions, but this does not affect the quality of service that Egypt doctors and Egypt hospitals offer, of course. EgyptAir, as the flag carrier of Egypt and its subsidiaries, which is the hospital and tourism company and airlines, we offer a very strong facilities, either at airports, either on board the flight, or inside Egypt, starting from the arrival of the patient or of the customer. I would like to say it's a customer for us, it's not a patient. From this part or from this location, EgyptAir is doing. We had the idea of having a project together to serve and to provide distinguished services to our customers. What EgyptAir offers to medical tourism projects? Why a patient or any customer who would like to have surgery, a treatment, a rehabilitation, or even consultation could or can choose EgyptAir medical tourism project, because we have high-profile doctors and professors, reasonable surgical prices, follow-up with patients, accredited hospital, of course, strong medical partnerships with service providers and third-party suppliers. We offer door-to-door quality service, a well-caring staff during the whole process, and a hassle-free package, which is what we are talking about regarding the visa entry, the on-board flight services such as wheelchair, medical assistance on board flight, and so on. Researchers proved that customers' motivation factors are main three motivation factors, which are the medical expertise, which is the main, and then the location of the place the patient will come to have the treatment, and third, the price, of course. The process EgyptAir is providing for its customer coming or seeking the medical tourism facility is the medical treatment, of course, the flight ticket, the discounted flight ticket, as Dr. Samih mentioned before earlier. EgyptAir has offered a discount for the package for any patient seeking medical tourism. We offer also the accommodation. As I mentioned before, we have more than 10,000 commitment with hotels all over the world and and inside Egypt, covering all the cities. And we also facilitate the entry visa procedure for any nationality that requires um, uh, special papers and special treatment. This process, of course, starts from the consultation until the patient comes to Egypt, and then handling his accommodation, his transportation, his sightseeing tours, of course, after the surgery, if he's staying, his accompanying persons. The steps that EgyptAir follows to achieve the target of doing a hassle-free package for the patient starts from build an ongoing relationship with the customer since the planning phase of the medical journey till the decision to take the travel, then how to make his stay in Egypt comfortable and affordable as well. We start from the trigger and inspiration to the customer to choose EgyptAir project, medical tourism project, and then we help him to decide and book the hotel within the budget he's having, preparing and planning the whole trip for him. During the flight, if he needs any special treatment, we do it. We stay connected with the patient, and this is a very important factor that that build loyalty with the customer to come again or to recommend the services of EgyptAir tourism, medical tourism project. And then we stay involved after the surgery and after he returns home. We stay connected and involved with the patient and with the customer to build the relation that stays and build the loyalty with the customer. This is in brief what EgyptAir is offering, and we will be, of course, part of the online system that the government is doing now, and I hope I didn't say long speech, but thank you.
Thank you, Manheba. Now, our next guest is the founder and CEO of Health Beyond Borders in Dubai. She was responsible for the development of the policy and legislation for the health system in the Emirates of Dubai, driven from the Dubai Strategic Plan. Mrs. Laila Al-Jasmi.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's a great pleasure to be in Egypt, and especially in Cairo. And I would like to thank Dr. Ayman Salah for the kind invite to be at the conference today. And thank you also Dr. Karim for all the arrangements and to make my trip to Cairo so nice. The great experience I had also being on EgyptAir. It was my first trip actually in EgyptAir, and I was very impressed with the service and with the whole crew and the craft itself. So thank you very much. So I'm going straight to my presentation. We have been, all the days we have heard about the medical tourism. Thank you. We've heard about the medical tourism. So why everybody speaks about the medical tourism? Now, the medical tourism is a very competitive market, and it helps country actually to elevate. It helps them to regulate very well the healthcare markets. It also improve and drive the insurance, and also had a great opportunity for public-private partnership because it increased the investments into the healthcare. And this is something that we have seen in the Gulf region. So in my presentation, I will be speaking about the GCC country and what's been happening in the region of the Gulf. Now, Abu Dhabi. Abu Dhabi started the medical tourism initiative as a government for the city of Abu Dhabi. And why is that? Because when they look at the market, they've seen that the market is being great, and there is a lot of revenues that you can make from the medical tourism market, and where Abu Dhabi can have a good share of 12.5 of an annual increase of revenue into that market. So why Abu Dhabi? Because Abu Dhabi has a less waiting time, and this is something that we have seen as one of the challenges in the medical tourism. There is a lot of international partnership that the Abu Dhabi government has done as a healthcare provider with a private provider, and there are certain personalized services that they have. So they said, why we don't experience that in the medical tourism industry? Now, these are some factors of success. If we want to go into the medical tourism industry, we have to make sure that we do have certain factors of success. What are they? Now, according to the Ipsos City Index, Abu Dhabi was rated as one of the most safe country or a city in the area, overtaking Paris and London, and in the top 5 best infrastructure worldwide, and the top 3 regional and 10th international airport. Now, there are certain matters also you need to consider. It is a cosmopolitan city, so we have people speaks more than different languages in the city. Over 190 nationality is living in a very peaceful way, very smooth, flexible, and encouraging city for an investment. And of course, medical visa is one of the things that Abu Dhabi has looked at when they started their medical tourism initiative. Now, these are the services that they have specified. So if you are going to go for medical tourism as a destination, you need to specify which services you want to attract your customer in. You cannot say that you are good in everything. Nobody's good in everything. So you have to be very careful to promote the services that makes you are a center of excellence, there where you want your patient to come to you. All right? So these are of the services that they started with. And then, oh, I'm sorry, but it doesn't look very clear in here, but the tourism inflow in Abu Dhabi has reached 4.1 million tourists. So, and this is what's been happening. Your tourism Ministry of Health works with your health, with your Ministry of Health, because that's very much indeed important, because you have 2 arms that drive your medical tourism initiative in your country. And this is what has happened in Abu Dhabi. Now, these are the portals. Abu Dhabi has established their own portal. It's called Abu Dhabi Tourism, السياحة في Abu Dhabi. So this is for them was the branding. And we are going to speak about the branding tomorrow, inshallah, in the workshop. So the portal of Abu Dhabi Tourism for the medical tourism specifies certain features. They have medical dictionary that specify all the hospital clinics. They have tourism directory where their customer looks at where are the touristic attraction, where they can book and all of that. And then they have the patient information features, which help the patient to know exactly what they need to do if they are coming to Abu Dhabi as a medical tourism destination. Dubai. You've heard about Dubai Medical Tourism Initiative. It was launched in 2012 by the Crown Prince. Now, why Dubai? Because Dubai as an industry has 46% of medical tourists in Dubai that comes from the Asian countries, 25 from GCC, 13 from African country, and 16 are from other countries like UK, CIS countries. Now, these are the countries that Dubai specify that there are attractive countries for them as a medical tourism destination. So they have countries that have high attractiveness, like the GCC country, you can see here, United Kingdom, and also Pakistan and India. Okay, and this is actually, they depended on the tourist information from the Department of Tourism. They have country of a high attractive, which they specify, and they have medium low attractiveness. Why this is important? Because that helps them to go the market that they need to go to and promote Dubai as a medical tourism destination. So this is an exercise which is really very much indeed important, that you need to take it into consideration. Now, factors of success for the health tourism in Dubai. Dubai is very well strategically located, politically very stable. It has a very good infrastructure for tourism, and also regulatory-wise, they are very well stable in the healthcare. They had mandated the accreditation and quality in healthcare. They are promoting the accreditation in medical tourism, and this is very much indeed important. And they had actually launched the public-private partnership law for Dubai Emirates that actually had attracted a lot of investors into the healthcare. So these, all of the areas that attracted a lot of investors coming in and actually indirectly supported the medical tourism initiative. Don't forget also the health insurance scheme that has been launched fully in Dubai has actually also promoted the patients to come for the treatment, because they have been aligned with a lot of international companies and the insurance that help to send their patients to Dubai for the treatment. So you can see indirectly the medical tourism initiative actually brings to you a lot of incentives and a lot of services accordingly. Now, these are the services that Dubai said. They said, we are going to promote Dubai on those services, and we are going to go to our segment markets to promote Dubai into these services. This slide is very important, and this will be my slide before the last. So what is the program of Dubai Medical Tourism Initiative? The program starts with Dubai Health Experience. This is the brand of Dubai, DXH. So they said, we are going to promote Dubai, and we are going to speak about DXH, is Dubai Health Experience. This is the brand that Dubai took, and they start promoting their health tourism initiatives. And they build up the portal, and the portal has been launched. So patients access the portal, they see the provider. Now for the provider, they haven't taken all the provider in Dubai. We have more than 2,500 providers in Dubai. They haven't taken them a lot. They've taken those who are quality accredited, so patients feel safe, comfortable when they come in. So this was one of their mandates. And those providers are the ones that are going to promote Dubai as a medical tourism destination. So this is one. They have the Dubai Healthcare City, which is the biggest large free zone for the healthcare provider to come to Dubai and practice in a certain flexible free zone regulatory system. They had partnership with international patients. Dubai has partnered with King College, with Moorfield, and recently with Parkware for the eye hospital. And this is very much indeed important because it gives you an exposure to the international world. So these are one of the driven factors for Dubai Medical Tourism Program. The Medical Tourism Club, this is initiated by Dubai Health Authority, the Medical Tourism Club, and this is where all the stakeholders from the private sector, as well with the government, as well with the stakeholder, they come together and they network together, and they speak, they open, they say what are their challenges. So the government is there, they hear them, they work together on how they can facilitate things going forward. So this is very much important. In other countries, they name it as Medical Tourism Council. So you have to establish a council on a country level that have all your stakeholders on it in order to speak with each other, to understand what your challenges and what is your expectation and what's the government's expectation from you. So this is very important step to take forward. The International Patient Assistance Center, this is very much indeed important, and this is within the hospital, which is the program has actually encouraged hospital who wants to go into the medical tourism program in order to have a well-developed international patient center in order to know how to handle those patients coming abroad for treatment within your hospital. Last is the wellness tourism initiatives, and this is something new added to the medical tourism of Dubai, is that to promote Dubai in the wellness arena. And these are some of the international events that Dubai does, and this has helped to promote the medical tourism initiative as you are doing now for Egypt. This is a promotion for the medical tourism initiative of Egypt. And last, about the Kingdom of Saudi Arabia, we have more than 100 people are traveling across the kingdom, spending out of pocket abroad in Southeast Asia, in Europe, in India. And this is something because there are people, and as you know, the Kingdom of Saudi Arabia is very huge. There is a lot of demand into the healthcare, and recently the Kingdom of Saudi Arabia is actually in the review of their medical tourism strategy. And lastly, just to share with you, is Qatar. Qatar is actually in the process of developing their medical tourism initiative for Qatar state, and that's what gives you an idea of how the different Gulf countries are looking at this initiative as something that is really helping in the development of the health sector of the country from the perspective of the quality and the perspective also of driving the healthcare market in that country toward an international exposure. Thank you very much.
Layla? Now I want to introduce a pioneering woman in the field of medical tourism. She is the founder of one of the leading and oldest companies of medical tourism in Russia, Medicatur, and she's a famous speaker and an expert in international conference and congress. Please welcome Ms. Tatiana Sokolov.
Dear colleagues, first of all, I would like to thank the organizers of this event for invitation. It's very, very pleasant for me. And I hope that this event will be useful for all of us, very good networking, new ideas, and somewhat about me. I have a medical tourism agency in Moscow, Russia, and I am in medical tourism from 26. I have big experience, and I am author of 3 books about medical tourism. My first book, Business for a Lady of My Life in Medical Tourism, is the first book in Russia about medical tourism. This book is available in English language too. My second book, Reflection During Isolation, I wrote these books when during pandemic time. And the third book, Model of Work with Patients in Medical Tourism. Second and third books available only Russian language. Also, I am author and lecturer of course Medical Tourism in People's Friendship University in Moscow, Russia, name of Patricia Lumumba. And we all know that medical tourism is a very rapidly increasing branch of economy. We can see in 2024, volume of medical tourism market is $84 billion. It will increase till 2029 to It's very big number. The fastest growing medical tourism market is Asia Pacific region. And the largest market medical tourism is North America. If we want to be successful in medical tourism sphere, we must use innovative trends in medical tourism. And I want to speak now about 10 medical tourism innovative. First, telemedicine. Online consultation became most popular in pandemic time and now. And our company organized online consultation with famous doctors in different countries for our patients. It's very help us in our work. Artificial intelligence. Artificial intelligence can be used to analyze large amounts of international patients' data and create customized treatment plans for them. Also, using chatbots. Our company uses chatbots for filter hot and cold medical requests. It's very help us. We use them also for evaluation of leads and also for retargeting. 3. Using virtual reality. For example, virtual tour in the hospital. Integrative medicine. Integrative medicine or holistic medicine. This method not treat symptom or disease, treat whole person as all. And in January, our company with Russian delegation were in China, in Iceland, Hainan, and all our delegation tried this method also. Financial technology, very, very convenient online payment for our patients. 6. Automation of process. Also for lead generation, using CRM system, marketing automation, and sales automation. 7. Digital continuous care. This is electronic devices for remote monitoring of our patients. 8. Behavioral marketing of our patients. 9. Data analysis. And last, personalized and customizable recommendation for our patients. And some words about me. Thank you for your attention.
Thank you everybody for the presentations. Just a comment for Mrs. Layla. ليلى هانم، هو طبعا الامارات سواء دبي او ابو ظبي عملوا طفره جامده جدا في مجال السياحه العلاجيه، تمام، والتركيز على السياحه العلاجيه اكتر من الاستشفائيه في دبي، تمام. بالرغم ان هو السياحه الاستشفائيه لو احنا بنتكلم على الانكم اللي ممكن يجي منها دي ماني ميكر، يعني لان حضرتك ما بتستعمليش زي في المستشفيات لا كونسيومابلز ولا ادويه ولا بتستعملي اي حاجه، انت بتقدمي سيرفيس سبورتيف سيرفيس. فليه ما يعني بالرغم ان عندكم طبعا حاجات طبيعيه كتيره برضو ممكن تخليكم انفولفد جامد في السياحه الاستشفائيه، فهل لسه ده في البروجرام بتاعكم هيجي ولا انتم مستبعدين تماما ان يبقى انتوا انفولفد في موضوع السياحه الاستشفائيه؟
شكرا على الملاحظة. بس الموضوع هذا أبو ظبي الآن بدأت تضيفه as a wellness tourism، بس مع دائرة الثقافة والسياحة لحكومة أبو ظبي. دبي لو لاحظت في البروجرام لما حطيته كان في wellness and spa، هذا الشيء أضافوه بعد في البرنامج بس مش في البداية، ضافوه يعني تقريبا من حوالي 3 سنوات كجزء من برنامج السياحة العلاجية في إمارة دبي، وسموها السياحة الصحية دبي هيلث اكسبيرينس. أبو ظبي لا زالت أبو ظبي للسياحة الطبية، أبو ظبي ميديكال توريزم، بس خلوا الونس مع دائرة الثقافة والسياحة، وخلوا دائرة الصحة في أبو ظبي تمسك بس الميديكال توريزم. دبي لا، عملت ضافتها مع السياحة وسمتها دبي للسياحة الصحية. بس مثل ما تفضلت كلامك جدا صحيح. The amount of wellness revenue is actually more than the medical tourism revenue. And why? Because now everybody is actually looking on how to stay healthy and live very better a healthy lifestyle to avoid medical sickness at a later age. So you are absolutely right.
Thank you very much. طبعا في حاجه ثانيه بالنسبه للسياحه الاستشفائيه، هو كان احنا عندنا ستاندرد واكريديتيشن للسياحه العلاجيه، المستشفيات بتاخد اكريديتيشن والمراكز الطبيه، ولكن ما كانش فيه ستاندرد عندنا في مصر ومش موجود في اي حته في العالم حسب معلوماتي يعني للسياحه الاستشفائيه. علشان اعمل سنتر للسياحه الاستشفائيه لازم يبقى ليه ستاندرد ولازم ياخد اكريديتيشن. احنا عارفين ان هو عشان نعمل مركز استشفائي، واحنا زي ما قلنا في مصر عندنا 1356 عيون كبريتيه وناس 60% من الرمال السوداء، وعندنا الجبال الرمل سوري جبال الملح والحاجات دي كلها ليها انديكيشن معينه لاستعمالها في علاج او لتخفيف الاعراض بتاعه الامراض. فما كانش عندنا خالص ستاندرد للسياحه ولا مركز من العيون الكبريتيه دول كنا ممكن نقدر نحطه على المنصه الالكترونيه، لان حضرتك عارفه عشان نعمل مركز استشفائي انا محتاج اربع حاجات. اول حاجه ترانسبورتيشن سهل وميسر، وتاني حاجه فندقه كويسه مش 5 ستار، يعني اللي بيروح للاستشفاء ما بيدورش الفايف ستار اكوموديشن. وتالت حاجه مصدر الاستشفاء يبقى على مستوى من النظافه واللي قائمين عليه بيكونوا ذو خبره في المجال بتاع الاستشفاء. ورابع حاجه واللي انا اي بليف ان هو ده موست امبورتنت، لازم يبقى في ميديكال فاسيلتي نير باي، لان في زي لو شفنا الواحات الداخله والخارجه وسيوه وحمامات فرعون والحاجات دي كلها مشكلتها ايه؟ ده ما فيش ولا ميديكال سنتر نير باي. يعني بتاع سيوه لو احتاج جات له مشكله ودي اتكسرت او جاله هارت اتاك او مش عارف اي مشكله صحيه بيسافر 9 ساعات وشويه. تمام؟ فالاربع حاجات دول مهمين جدا، اللي هو الترانسبورتيشن اكوموديشن المصدر الاستشفاء نفسه، اخر حاجه لازم يبقى فيه ميديكال فاسيلتي نير باي. فاحنا قعدنا في الحقيقه عملنا 12 جلسه، والدكتور اسعد طبعا كان دايما منورنا علشان نحط الستاندرد بتاع الاستشفاء، مراكز الاستشفاء، بحيث انها تاخد اكريديتيشن زي المستشفيات وخلاص فاينلايز الموضوع ده تماما يعني. فانا بشوف ان هو الاستشفاء لو فكرنا فيها من ناحيه فيري برود سيرفيس ممكن يتقدم فيه اللي هم المتقدمين في السن. وحضرتك عارفه حضرتك ممكن تجيب العالم كله 12 شهر في السنه، لان نص العالم بيبقى برد 6 شهور والنص الثاني برد في 6 شهور، فانت حضرتك ممكن تأتاك المتقدمين في السن 12 شهر في السنه. وبعدين تاني حاجه استشفاء السياحه الاستشفائيه لذوي الاحتياجات الخاصه. تمام؟ وام شور 100% من اي حد عنده حد من اللي هم ذوي الاحتياجات الخاصه هيبقى كين ان هو يتحط في مكان كويس بفاسيلتيز كويسه واندر ميديكال سوبرفيجن كويس وكده يعني. فطبعا انا بحيي جدا طبعا المجهود الرائع اللي حصل في المنطقه اللي اتعملت ثوره. في الحقيقه انا بشوف دبي وابو ظبي عملوا ثوره في هذا المجال، ان هو حصل قفزه جامده قوي في خلال سنوات قليله. بس زي ما قلت لحضرتك قبل كده كان شايف التركيز على الميديكال راذر ذان الويلنس. بس كويس ان انتوا بداتوا السكه دي، واحنا نتمنى ان شاء الله ان احنا نبقى مع بعض فيها. يعني انا عايز اقول لحضرتك احنا ممكن ما يعني we shouldn't compete مع بعض، ولكن نكمل بعض. هي دي اللي هو بنسعى عليه يعني. واحنا بنرحب جدا بالتعاون مع الاخوه في الامارات في هذا المجال في السياحه الصحيه، لان دي بالنسبه لنا يعني ممكن تكون مصادر كثيره جدا. وبعدين عايز اقول لحضرتك حاجه، السياحه الصحيه ان جنرال بيرفع مستوى الخدمات الطبيه في اي بلد بيتقدم فيها السيرفيس ده. تمام. بنرفع الاكريديتيشن والتريننج وكل حاجه، المنظومه كلها بترتفع وبتخلي ينعكس ده كله على ايه؟ بالايجاب طبعا على المواطن اللي هو موجود في بلدنا. شكرا.
طبعا الله يسلمك، الملاحظات كلها اللي قلتها يعني ما اختلف وياك عليها فيها، بالعكس يعني احنا نتعلم من بعض. انا بالنسبه لي اليوم اللي شفته في الافتتاح عن التكنولوجي اللي استخدمتوه على ايجيبت اير مع فودافون، انا صورته فيديو يعني، وانا ناوي يعني طبعا يعني اني اوصلها للمعنيين، لان انا احس يعني بالعكس يعني اللي انتم سويتوه شيء يعني احنا الى الان ما سوينا، ما فكرنا فيه، عرفت كيف؟ فبالعكس مثل ما انت تفضلت، الكومبيتيشن المنافسه هاي منافسه صحيه، لان احنا نتعلم من بعض. يعني مثل ما انت تفضلت السياحه الاستشفائيه، طبعا مصر فيها اماكن يعني شو بقول لك، يعني احنا يعني ما في اي مقارنه من هاي الناحيه بالويلنس، بس مثل ما تفضلت عندنا بعض الاماكن يعني ممكن انت تستغلها كويلنس، عرفت كيف؟ قطر مثلا صار لنا طبعا الاونر ان احنا نشتغل معاهم في برنامجهم مال السياحه العلاجيه، وفكروا مثلا يابوا مركز متخصص في الاستشفاء وتحت شركه زلال، وهذا one of the unique بالريجن، يعني مو موجود ولا في اي منطقه من دول مجلس التعاون. فلو ان احنا يعني ساعه بس سفر ما بين الدول، بس احنا نتعلم من بعض ونحاول نكمل بعض، لان انت في النهايه هو العميل الكاستمر اللي انت عندك هو اصلا كم اساسيه لمصر ولا يروح الامارات ولا يروح قطر، المده وايد بسيطه، فاحنا لازم نوفر شيء ان نجذبه وفي نفس الوقت احنا نكمل بعض. والكومبيتيشن هذا صحي، بالعكس مثل ما انت تفضلت يساعد ان كل مقدم رعايه صحيه يتطور في خدمته، يجيب الافضل، يكون هو يونيك بالخدمه اللي هو يعطيها. حتى ما بين في مصر نفسها انت راح تخلق نوع من المنافسه، بس المنافسه الصحيه، لان انت تبغى تقول طيب انت تبغى تجذب هالعميل، كون ذكي بالطريقه اللي انت تقدم الخدمه فيها، اساس ان العميل يجيك عندك ويستمر معك، ما يجيك مره ويروح. فالsustainability of having your customer stay with you, this is the smart and this is the trick that you want your يعني your clients to learn about it. فشكرا على ملاحظتك.
Thank you very much. أنا عايز أقول لحضرتك حاجتين I believe فيهم 200%. أول حاجة إن في ساعات التعاون أو التكامل ما بين two body يخلي النتيجة أكتر كتيرة جدا مما أي حد يتخيلها. يعني ما يبقاش واحد يساوي 2، ممكن يساوي 10 و20 و30. فطبعا إحنا بندي إيدينا 100% للتعاون مع الأخوة الإمارات في الإمارات إن إحنا نكمل بعض. تمام. وفي أماكن كتيرة جدا ممكن في مصر يتم الاستثمار فيها ونرفع فيها خدمات استشفائية بالذات وصحية كمان، وفي نفس الوقت بالنسبة للمصريين الأخوة المصريين إن هم يتواجدوا في الإمارات ويقدموا برضو خدمات بنفس الكفاية. وعلى فكرة في مثل يوناني أنا بحبه قوي، يقول impossible is an opinion it is not a fact. مفيش حاجة خالص اسمها impossible. تمام؟ ده رأي شخص. لكن لو احنا اشتغلنا مع بعض بفيجن واحدة وتول متنوعة هنقدر نأتشيف حاجات كتيرة جدا على مستوى العالم كله. شكرا يا فندم منورانا. شكرا.
Thank you so much for all the speakers for the very constructive and demonstrative presentations for the medical tourism. I just have a few small comments. The wellness tourism definitely is a growing market, and it's becoming mandatory just to think about it in every country that have the privilege. And they are thinking of the 11, now they are categorizing the wellness tourists in 11 categories. One of them, many of them, post-alcohol or alcohol addiction vacations and or treatment or wellness. The female-only travel. Many of them are like this. The post-divorce, when people are looking for something like this, post-pandemic vacations, they need to do this, and it's growing. And I think the numbers that we are seeing here is more related to the wellness rather than to the health or medical tourism. I have a few questions. I don't know if how are you tackling this. What about the insurance policy you have in Dubai or in Abu Dhabi? How do you do with this? The second, maybe Dr. Claudia can answer this. Do you think accreditation, I know 100% accreditation is extremely important. What kind of accreditation? Do you consider TMOS accreditation as part of the accreditation bodies that you consider when listing a facility for medical tourism, or you put it in your platform or not? Or just what are the categories that you put in your platform when you're thinking about giving the facility the right just to receive patients from abroad?
Okay, now thank you for your input, Dr. Ayman. And regarding, if we speak about the international medical tourists that coming to the Emirates of Abu Dhabi or Emirates of Dubai, both of them has actually grown into the health insurance scheme, and both cities are the citizens and the residents has to be mandatory covered by health insurance in order to live and work in the Emirates of Dubai and Abu Dhabi. Still, the national health insurance is not yet being announced for the Northern Emirates. However, by constitution for UAE national, they are covered by in the public hospital. Now, in regarding to international medical insurance, both city has promoted the international health insurance and attracted them to open an office in the two cities. Now, when I mentioned earlier about launching the health insurance scheme for the Emirates, why it is important? It's not because, okay, we get our national covered, it's that we are building the system of the insurance scheme in the Emirates, which is very much indeed important. Because once the system has been built up in the whole healthcare facility of the Emirates, it's very easy for international insurance to work at the Emirates and also to send their patient, because the system of claiming is there, the system of the co-payment is there, the system of invoicing the insurance company is being built up, and the infrastructure of the healthcare industry in the Emirates. And this is very much indeed important. And this was driven by the government, by the way. So earlier, when I believe Dr. Samir, right? Yeah, Samir, sorry. He spoke earlier about the government role in the regulatory. It is important here where it comes. Because the government has emphasized the health insurance scheme for the Emirates, had helped them to invest, to build the infrastructure for the healthcare industry to have the system in place. So it was very easy when they get international patients for the hospital to claim, to do the claiming of them, to invoice them, and even through the assistance company that they come through with those international patients, it was very easy for the healthcare provider to work on that perspective. Also, keep in mind is that having the assistance company, which is the facilitator, available in the region had helped also the hospitals in the process of invoicing, because a lot of facilitator works as a broker between the insurance company and between the hospital for all the invoicing process. But as I mentioned earlier, have the system in place is very much indeed important. Now, in Egypt, I think the full insurance system is not yet in place, right? Am I right or wrong? Yeah, it's not yet. But a smart hospital that build up their system for the health insurance scheme, it's very much indeed important. So if you build up your system, you invested in it, it helps you a lot to attract those international insurance.
And covered by against liability, against complications, against with this kind of insurance?
As a regulatory,
yes, I'm going to Abu Dhabi or Dubai just to do a knee replacement or whatever, and I have some complications like any patient can have it.
That's true. That will depend on the policy of each patient that come for treatment. But if we speak from, if you are, let's say, pointing the part of, let's say, malpractice. Okay. Now, yeah, in the malpractice, it is mandatory by the law, by the health authority, that all hospitals that license, they have a malpractice insurance for the hospital and for the healthcare professional working at that hospital. That's a mandatory in the licensing process of all the healthcare provider in United Arab Emirates. Now, for the patients that comes, I mean, to be treated, of course, I mean, there should have some kind of insurance coverage for the complication. That's, I mean, has to be built up within their policy.
Yes, I think some few countries now they started just to apply the insurance for their international patients. They just pay for $200 or 200 euros just to cover the patient complication during it's out it's away from the package. It covers the complications that might happen during the operation, and also for 1 year post treatment or post intervention at home. And just to keep the patient 1 year in Dubai, and while he is coming from the UK or from other countries just to do this, he can stay at home and you pay for him, or the insurance pay for him.
So it's very much important that the hospital protect themselves when it comes to international patients, when it comes to complication, and they look into this. Now, working also on the health insurance industry, a lot of hospitals do reinsurance. And the insurance policy helps them in case of these kind of matter that can happen with certain patients, that they end up with a complication and they don't have a proper insurance coverage. So hospital has to look from the both ways. So that's something that you need to look at. Yeah.
And one last question. I was talking about this in this morning. If a patient just had a complaint, I'm having a complaint, you have a number or a way just to for the patient to complain and just for
there are a system within the health authorities for patient complaint. They have to go to the website and they go to the regulatory sector, and then they pick up the icon of the complaint services. And the complaint services, they have different ways of complaining, either about the services, if it is a negligence, or if it is a malpractice. So we do have that all electronically available on the website of the health authority. Yes. And from my experience, I mean, there has been patients who has been treated in the Emirates of Dubai, and they flew back home, and after a year, the patient come complaining into one of the private facility for their medical condition, and still the government has opened and investigated the matter. So this is very much indeed important, is that you have that build up in the system, but from the government, the Ministry of Health perspective. Yes, and available online will be even much better.
Accreditation in TIMOS in the Gulf area.
Accreditation in the Gulf area. Yeah, we do have accredited organizations in the area. And we are also involved in most probably 2 projects now, also supported by governmental organizations in the area. But it's still top secret. No. Okay, so one of them was Ms. Laila mentioned it was Qatar. So and we were involved in a project to support the country strategy development of the country of Qatar. So that's just submitted. And yeah, the other one we can't talk. So that's where accreditation, I think, is getting a more visible and more important role in the strategy development of countries and also in hospitals themselves, to show the world that patients can trust in the organization. If you ask me today, you didn't directly, but if you ask me, do patients know about accreditation? I would say the answer is still, most of them don't. And this is the frank answer. And I think if you hear anything else, it's wrong. But what does accreditation do? Talking about TIMOS, we do publish, and this is one part of the question you raised a few minutes before. We do publish all organizations on our website with all the services that provide. You know that we are not only a medical tourism accreditation body, we are an alternative to the international accreditation bodies. So not all of our accredited partners are going for medical tourism, so they are listed with the services they offer, not interested in international patients. Then we have those who went, like your hospital, for the excellence in medical tourism. And again, we list all the services and represent the organization. We present all our organizations in the same way because we have to avoid conflicts of interest. We cannot promote one and the other not. So as soon as you have TIMOS accreditation, you fulfill the standards and you deserve to be published. So back to the question regarding patients, it's publicly available. Every patient can look on the website, and they do it, and they see the neutral information of an accreditation body presenting the hospitals and clinics published. What patients nowadays still feel, and this is what we get as a feedback, they don't know about which seal is good or bad, but if they went to a hospital which has good services and they experience good services, they afterwards say, and you know what, this hospital is even accredited for its services, and it fits, you know, the picture fits to the expectation, and the perception is there. So this is how it works still. I would love to say soon that patients know about what to look for, but we are still not there.
You can mention the example of patient actually, which you say patient doesn't know, but I'm telling you patient does know, because there has been an incident where there are hospitals that are accredited by TIMOS and patient get to know and they file to you the complaint, right? So you can,
yeah, but I don't want to work. Yeah. Yeah, that's true. So you talked about complaints, and what we you asked for governmental complaint management, but we have also our procedure very clear. So if a patient experiences any bad experience in a hospital, and we were approached from Latin America in this case, then we also start an investigation. So we will have different channels to contact us, and we would also investigate that, so that we can ensure that somehow as a mediator first, and then to try to help in this case between the hospital and patients. Does this answer your question? Okay, super.